Remote health monitoring is a transformative component of modern healthcare, leveraging technology to track patients' health data in real time without the need for traditional in-person visits. It encompasses the use of wearable devices, smartphone applications, and interconnected systems to collect and transmit critical health metrics such as heart rate, blood pressure, and glucose levels to healthcare providers. This system not only empowers patients with the ability to manage their own health from the comfort of their homes, but also equips healthcare providers with up-to-date data, facilitating timely interventions and personalized care strategies. The significance of remote health monitoring lies in its ability to revolutionize patient care by making it more proactive and efficient. This approach underpins the larger shift towards telehealth and digital healthcare, a movement accelerated by the global pandemic. As healthcare systems worldwide face challenges of accessibility, cost, and resource allocation, remote health monitoring presents a viable solution to alleviate these pressures. Real-world applications of remote health monitoring are already reshaping patient experiences. For instance, wearable devices like smartwatches can continuously gather health data, alerting users and their doctors to any anomalies. This is particularly beneficial for patients with chronic conditions, enabling early detection and management of potential health issues. Another application is in telehealth services, where patients can monitor their vitals and share this information with healthcare providers via digital platforms, facilitating remote consultations and reducing the need for hospital visits. These innovations are widely supported by healthcare professionals and technology experts who advocate for the integration of digital tools in healthcare delivery. They argue that such advancements lead to improved patient outcomes, reduced healthcare costs, and better resource management. However, the implementation of remote health monitoring is not without challenges. Concerns about data privacy and security are prevalent, prompting debates about safeguarding sensitive health information. Additionally, there is a risk of technology over-reliance, where the human aspect of patient care might be diminished. Critics also point out the digital divide, as not all patients have equal access. Overall, remote health monitoring is a pivotal element that not only enhances digital healthcare through wearable devices, but also supports the broad adoption of telehealth. It complements the main topic by highlighting innovative benefits and challenges, revealing how interconnected systems can improve healthcare delivery and outcomes, transforming the landscape of healthcare in profound ways. Remote health monitoring, facilitated by wearable devices and telehealth technologies, is a revolutionary approach in digital healthcare that allows for real-time tracking and management of patients' health data outside traditional clinical settings. This concept leverages interconnected devices and data analytics to provide continuous oversight of an individual's health status, enabling proactive and personalized care. The significance of remote health monitoring in the healthcare landscape cannot be understated, as it represents a shift towards a more patient-centered approach, offering convenience, increased access to healthcare services, and potentially better health outcomes. One real-world application of remote health monitoring is the use of wearable fitness trackers to monitor patients with chronic conditions like diabetes or hypertension. These devices continuously gather data on vital signs such as heart rate, activity levels, and even blood sugar levels, providing healthcare professionals with critical insights into their patients' health in real time. Another example is the use of smartwatches that can detect irregular heart rhythms, such as atrial fibrillation, alerting users and their doctors to potential health issues before they become serious. Proponents of remote health monitoring highlight its ability to reduce healthcare costs by minimizing unnecessary hospital visits and allowing for early intervention through timely data insights. By empowering patients with their own health information, remote monitoring encourages greater engagement and responsibility over personal health, which can lead to improved long-term outcomes. However, there are challenges and controversies associated with remote health monitoring. Privacy concerns are paramount, as the collection and transmission of sensitive health data over digital platforms pose risks of data breaches. There is also the challenge of ensuring device accuracy and reliability, as incorrect data could lead to inappropriate medical interventions. Additionally, there is a digital divide that may limit access to these technologies for some populations, potentially exacerbating healthcare disparities. Remote health monitoring influences other aspects of digital healthcare by integrating with telehealth services, allowing for virtual consultations based on real-time health data. This integration not only enhances the quality of telemedicine services, but also supports the broader aim of creating a more connected and efficient healthcare system. Overall, while remote health monitoring offers promising benefits, it also necessitates careful consideration of its challenges to fully realize its potential in transforming healthcare delivery. Enhancing patient engagement and empowerment through wearable devices is a transformative concept within remote health monitoring, signifying a shift towards more patient-centered healthcare. Wearable devices, such as smartwatches, fitness trackers, and digital health patches, continuously collect valuable health data, such as heart rate, sleep patterns, and physical activity levels. This technology empowers individuals by providing real-time insights into their health, allowing them to take a proactive role in managing their well-being. The significance of this point lies in its ability to transform passive patients into active participants in their health journey. By having access to their health data, individuals can make informed decisions, adhere more closely to treatment plans, and engage in preventative health behaviors. This increased engagement leads to improved health outcomes and enhanced quality of life, aligning seamlessly with the overarching goals of remote health monitoring. Real-world applications of this concept are becoming increasingly common. For example, patients with chronic conditions like diabetes can use wearable glucose monitors to track their blood sugar levels in real time. This empowers them to make immediate lifestyle adjustments, reducing the risk of complications. Similarly, wearable ECG monitors enable individuals with heart conditions to detect irregularities early, facilitating timely medical intervention. Support for the idea of enhancing patient engagement through wearables comes from healthcare professionals who observe improved patient adherence and satisfaction. By feeling more in control, patients are more likely to follow medical advice and maintain consistent communication with their healthcare providers. However, there are challenges and controversies associated with wearable devices. Privacy concerns arise from the continuous collection and transmission of personal health data. Ensuring data security and obtaining patient consent are critical. Additionally, disparities in access to technology could exacerbate existing healthcare inequalities, leaving some populations behind. Critics argue that an over-reliance on wearable data might lead healthcare providers to overlook the importance of personalized patient care. This point connects with other aspects of the main topic by highlighting the role of wearable devices as a key enabler of telehealth and digital healthcare. By facilitating constant health monitoring, these devices support telemedicine consultations, allowing healthcare providers to offer tailored advice without in-person visits. This integration of technology in healthcare not only makes healthcare more efficient, but also more accessible, paving the way for a future where patients are truly at the center of their own care. Remote health monitoring represents a transformative approach within the field of healthcare, utilizing advanced technologies like wearable devices to track and manage patients' health data in real time. This form of digital healthcare empowers individuals to continually monitor vital signs, such as heart rate, blood pressure, and glucose levels outside of traditional clinical settings. These technologies are pivotal because they provide unprecedented access to continuous health data, enabling more proactive and personalized healthcare interventions. The significance of remote health monitoring in the context of modern healthcare cannot be overstated. Firstly, it offers significant potential for early detection of medical issues. By continuously monitoring health metrics, healthcare providers can identify warning signs of potential health problems before they become severe, enabling early intervention and potentially improving patient outcomes. Secondly, it enhances convenience and access to healthcare services, especially for individuals living in remote or underserved areas. This can reduce the need for frequent in-person visits and allow for ongoing management of chronic conditions. For example, diabetes patients can use continuous glucose monitors to keep track of their glucose levels, receiving alerts when levels are too high or too low, which can help them manage their condition more effectively.